Hi guys, welcome back to the channel. I'm Dr. Downey and today we're going to discuss aspirin, the drug aspirin. I am a bit under the weather and if I sound a bit odd that might be why, but let's get into it. So I'm discussing aspirin because I got a question about it the other day, and since there's such a high incidence of myocardial infarctions or heart attacks in the bodybuilding industry, individuals want to know if they should take aspirin because it is known that aspirin reduces the chance of getting a heart attack because it thins the blood and things like that. So let's discuss it as a possible treatment choice for primary prevention in cardiovascular disease. So essentially, this is for individuals who have never had a heart attack or have not had scans that display they have a clot in there or build up a plaque in their arteries around the heart, in their coronary arteries. So how does it reduce cardiovascular mortality or just, cardiovascular events? It actually binds to the cyclooxygenase 1 enzyme essentially, and this enzyme's responsible for producing thromboxane A2, which causes platelet aggregation and thrombosis or clotting. But if aspirin binds to this and prevents the production of thromboxane A2, and this occurs at a low dose. So at a dose of 75 to 30 milligrams, it has been shown to decrease the chance of this happening. At a higher dose, it blocks the cyclooxygenase 2, and that's what is responsible for pain and for reducing fevers. So at higher doses, it has that pain effect. At lower doses, it's more anti or blood thinner essentially, although it's not really a typical blood thinner. It also has been postulated and been shown in a meta-analysis that it decreases chances of colorectal cancer, and this is through the prostaglandin pathway, since those are known to increase the chance of angiogenesis and cancer alike. So again, we're discussing primary prevention. This is for individuals who have no previous history of cardiovascular disease. So should you take it? I'm going to base this off meta-analyses, so it's the highest form of evidence, and then you can make the decision by yourself. So based on meta-analyses after meta-analyses, it seems that taking a daily dose of low dose aspirin, that's 75 to or 100 to 75 milligrams a day, it had very little impact on reducing cardiovascular mortality and all-cause mortality, and the evidence for that is very high. It's evidence for reducing non-fatal myocardial infarctions, so just heart attacks that don't result in death. There is moderate quality evidence that there is a reduction in non-fatal myocardial infarctions. It doesn't reduce non-fatal strokes all that much, and there's moderate quality evidence to suggest that. And in terms of colon cancer incidence, there is a possible reduction, and the quality of evidence is low because it's still kind of a new topic. So those are the benefits. As you can see, there aren't too many benefits. This is for the regular individual. But there are a few risks that come with aspirin use, and the major risk is bleeding, or major bleeding, in fact. And major bleeding is bleeding that makes you have to be hospitalized. And it usually occurs from the gastrointestinal tract. However, it can occur in intracranial, so in your skull, and that is fatal. The gastrointestinal tract bleeding is not as fatal. So in terms of the risk to benefits, they're almost one-to-one. So for every decrease or one person who doesn't have a heart attack, there's one person who gets a major bleed. So who should use the aspirin as primary prevention? Well, you actually need to calculate your risk, and I'll link a calculator for your cardiovascular risk in the description below. So if you want to calculate your risk, just use that. And if you look at the bottom, it stratifies your risk to see if it's low risk, moderate risk, high risk. So if you are stratified as low risk, it's recommended not to use aspirin. If you are stratified as moderate risk, the choice kind of is up to you. It involves the doctor and you discussing the benefits versus risks, since if you are at a moderate risk of cardiovascular mortality, in 20 years, out of 1,000 individuals, taking daily aspirin will reduce 17 non-fatal myocardial infarctions or heart attacks, but at the same time, 16 people will experience major bleeds, and possibly 13 fewer cases of colorectal cancer will be observed. So that's in 1,000 individuals if they were all to take aspirin and you compared it to 1,000 individuals not taking aspirin. So that, if you're at moderate risk, the choice is yours. If you're at high risk, the benefit is still only slight. And the risk is still present, but it's suggested that you do use it whilst the benefit is still only slight. If you were using steroids, let's say, which group would you be put into? So obviously this topic doesn't have a lot of research, but if you look at this calculator, you put in your stats, so things like your BMI, your LDL, HDL, blood pressure, and then whatever result you get from that, I would say you should stick to, because more or less, if your blood markers are fine, there shouldn't be an issue. But if you wanted to be on the safe side, I would put yourself into the moderate risk category, because even if cholesterol and things are normalized, there's still high risk of cardiovascular disease in steroid users. So possibly put yourself in the moderate risk group and then discuss with your doctor what you should do. So the American College of Cardiology says that people at high risk with low bleeding risk and between the age of 40 to 70 years should take aspirin prophylactically. No one else should. That's essentially their stance. The daily doses of aspirin you should take is between 75 and 100 milligrams daily. So this is just a fun section, or alternative medicine essentially, which does have a tiny bit of evidence behind it, but essentially 1 teaspoon of cumin daily has as many salicylates as 1 baby aspirin, and salicylates are aspirin is a salicylic acid essentially, so salicylates are postulated to work similarly to that of salicylic acid, and if you were to take the urine of individuals who have a lot of spices and fruit and vegetables, they have more or less the same byproducts or end metabolites in their urine as someone taking baby aspirin. So that's where the suggestion came from. Again, if we look at individuals who incorporate a lot of cumin and spices into their diets, as well as fruit and vegetables, they have been found to have lower cardiovascular disease as well as colorectal cancer, especially in the Indian population who use a lot of cumin. So that's just interesting, and a possible supplement you could take if you are not going to take aspirin daily, baby aspirin daily. So I hope that educated you in some way, or you found it entertaining. If you did, let me know in the comments below, leave a like and subscribe if you'd like to, and I'll see you in the next video.